Welcome to the High Tea with Grace podcast, where we spill the tea on HIT. Today, I'm live at the Civitas Conference, a vibrant event filled with healthcare technology leaders in the health information exchange space. Today, I'm honored to welcome Susan Clark and Laura Young of Converge Health. Thanks for joining me, ladies.
Thank you.
Happy to be here.
So tell me a little bit about the career path that brought you to this new venture today, and why did you decide to focus on the last mile of interoperability?
Yeah, so this is Laura Young. I won't give you the entire history of my trajectory, but I had the fortuitous opportunity at one point in my career to start up a behavioral health information exchange. And so there were a bunch of nonprofit providers. They had all gotten together. There was a big problem in the community they were trying to solve. And I got to be part of that effort. And it was really compelling. We got to do some really cool use cases, help the community, and do some cool things. I think we really thought that effort was going to springboard into this big movement, but the time wasn't right. So it really kind of languished for the last 10 or so years. So from there, I went on and ran a statewide health information exchange in Alaska, and then also most recently, the regional San Diego Health Information Exchange. So I have some boots on the ground experience with several health information exchanges, but it's always kind of come back to touching this sort of last mile of interoperability, which is behavioral health, social care data, SUD, and those kinds of really compelling use cases that touch whole person care. So really it was the stars had aligned. Several of the people that were part of the original behavioral health HIE effort were available, and we all kind of got together along with Susan here and started Converge Health. And so we focus on the last mile of interoperability, both for health information exchanges that are looking to add those difficult use cases, and then also helping vendors that are maybe behavioral health related become more interoperable. So really, we're touching kind of a couple of different things.
Thank you so much for doing that effort. I was a caregiver for a family member with major depressive disorder, and I can tell you the challenge you face as a caregiver when they are going from the ER to a psychiatric hospital to the therapist to a psychiatrist. I mean, that data is so hard to get into one place. So thank you so much for that effort. And I'm so thrilled that you're focused on this last mile, right? So Susan, tell me a little bit about yourself and your career path and why this is important to you.
Yes, I'm Susan Clark, and some people know me as the Health IT rock star on social media. And I always start with my very origin story, which is I started out in music and went on a scholarship for bass guitar. Found out I did not like it academically. I just wanted to be on stage. Moved home, didn't know what I wanted to do, landed at front desk at a clinic, which also led to medical records, which led to workflow issues at the beginning. So then big fast forward, lots of other stuff in between. But more recently, when Meaningful Use came out, and I was implementing EHRs, and I learned how policy translated to technology. So I got really involved with how the regs work, how legislation works, how does this all fit together, became a government contractor, so statewide HIE governance and Medicaid funding. And so a lot of how it works from a very high level, but I always and I start with the origin story because the most important thing to me is we got to get it down to the ground and the end users, which is what Laura's talking about, why we bond so closely is because it's not all there yet.
Absolutely. As we dive into this topic and the trend part of our conversation, let's talk about emerging gaps. What are some of the biggest fringe interoperability gaps that don't always make the headlines, but directly impact patients and providers in the last mile of care delivery?
Well, notifications seem like the easiest low-hanging fruit in terms of technical. And I think you probably hear this all the time. This really isn't a technology problem, right? Like the technology's there. It's really the workflow, connecting the right organizations together. So I think some of the big gaps it all comes down to whole person care, understanding the whole picture of a person. Do they have food insecurity? Do they have housing challenges? And then do they have a mental health issue that maybe a shelter house needs to help solve or manage if they're going to be in their shelter? So making sure that all of the different caregivers that are in someone's life have access to the information that's necessary. And then I think that's also where there's a big piece is around consent, right? Making sure that the right people can see information, but it's not too much information. And that's really where the balance is. I would also say that's has been one of the barriers in terms of organizations exchanging the information. They're a little afraid of the rules, right? And so they don't want to get in trouble. And I think that's another part of what we help solve.
I fell into, through state government, learning more about the justice-involved care. So when folks are incarcerated, they go into basically a black box because they have a small EHR, maybe don't have an EHR at all, depending on the jurisdiction, and there's no exchange in and out. So there's all kinds of duplicated testing, and they don't have that. And then when they come out, when they're during the reentry process, they go on and off Medicaid, they go on and off different insurers, and so both the exchange of information across payers, and then that re-entry and making sure they have a good footing in the community, both from health, behavior, STD, all those things, that trying to get the information out of what happened while they were incarcerated back into the community is not there. And so that's another population that you don't hear about as much that I think is a great use case to work on.
We've seen a lot of progress with frameworks like FHIR, TEFCA, but where are we still struggling to move from standards on paper to true usable interoperability at the point of care?
Hearing a lot of conversations here and what I've dealt with, I feel like it's a major translation problem. That out in the air quote real world, we're on audio here, providers don't know what an HIE is. They don't know what direct messaging is. Even though their EHR has it, there's no one and resourcing on having people in practice in the right locations that actually understand what the technology can do and how to implement it, how to optimize it. And so I think we have a lot of gaps in where we need technical assistance or better workforce needs so I don't think it's a technology problem. So those frameworks are great and keep going on TEFCA, but it's not reaching the ground right now. It is, and for those that can access that information, that's great, but it's not permeating.
And I think the other thing is it's a larger scale. And so when you scale up that kind of a network, patient matching and things like that, you start to have fidelity loss, I think, across that large geographic area. You're going to have a lot lower patient matching. So matching data, matching patient identities, and then bringing meaningful data back into a local provider organization, there's a lot of gaps. Having been on the ground, we used to analyze what that match rate was looking like. And we would know about a patient that was physically at the hospital and the data would not come back through one of the national networks. And it has a lot to do with patient matching and some of the things. I think the other issue is that it's also, you have to pull data versus getting it pushed to you. So the notification piece is not there. I think that's something that they are working on, which I think will help a lot, but you have to know already about somebody to go get the information to then see it versus being proactively notified that something is happening, right, with a person. And I think that's still a gap and a challenge.
Very interesting. As you're looking in the innovation space now too, particularly startups, smaller vendors, folks that you work on that side, they're trying to push the envelope on last mile interoperability. And what barriers are they facing compared to established players in this space?
It's similar to what you've seen with HIEs. They don't understand it, right? It's how do you talk to these different stakeholders that historically haven't had great access to technology? Their platforms may not be certified, and now they want to work with that population, right? And so how do we get that to happen? They understand that it's important, but now it's really how do they make that happen? So I think that's really where we're seeing a lot of emergence with the vendors. I think AI is really hopping into this space too. And so then there's a whole piece around what can we and can we not do with the last mile of interoperability and AI. So I think there's going to be a lot more conversation about that. Everybody wants to do AI right now. So
I would add a different lens of don't know what they don't know. A lot of times the smaller organizations have big hearts and want to solve things without having the background on regulations, compliance, or the standards that what's already in use best
practices
that they have to ramp up to that place. And so we try to help them avert having to start from square one and learn those things the hard way of how can we bring that forward of here's what you need to know, here's how you need to do your security and privacy work also. That's a big part of it.
As we kind of think about big hearts, what is the role of the patient themselves in playing and driving interoperability forward? And a lot of these conversations, they're talking about, the healthcare players And they're talking about the hospitals, health systems, and even some of the social drivers of health and the other fringe organizations. But it's like, what about patients and patient access? And obviously we know that payers now need to really prioritize patient access. Providers have had to prioritize patient access, and HIEs haven't had that same kind of initiative to drive them to participate in patient access, but many are. So tell me a little bit about that. What role can patients play in moving interoperability forward, especially when it comes to accessing and sharing their own health data?
The new CMS interoperability framework, I think, has been a good impetus to get that attention there, because if you want to get your name on the government website, you got to participate, right? But I'm still concerned that there aren't enough incentives or enforcement there. So even if providers and payers need to do this, do they really know how and why to do it and to actually serve the patients versus check the box activity again?
I would add too that from an HIE perspective, it's really hard to do the patient access piece for a number of reasons. First of all, who pays for it? Because patients won't pay for it, and providers would. The payer really should, right? I think that's probably where it belongs. But it's not, and these HIEs are typically nonprofits. They don't have a lot of margin to just add a free service, right, for patient access. It's not that they don't care about it. It's just, if you think about it from an operational perspective. And then the challenge is how much value, how much ROI is there really on it? Because there's death by a million patient portals type of thing. And I think that you want to have something that's going to be meaningful to a whole community. It can't just be your HIE. So I know I've seen some efforts where they're like, no, we really need to tie this into some other bigger community things that have community, 211 information that is in an app, along with maybe healthcare data, social care data, resources, things like that, where it's a really meaningful application that a patient would use. And so I think the patients would participate more. So I look at it more from a participation perspective versus a driving it forward perspective. I mean, at the end of the day, we're all patients, right? And we all want to be able to see our data. So I think we all have ideas how it should look, but then there's how it really works. And I think there's still a lot of work to be done there.
Looking ahead 3 to 5 years, what new opportunities or risks do you see shaping the last mile of interoperability? And this is from the HIE perspective, from the healthcare technology perspective. And what should health systems be doing now to prepare for that next 3 to 5 years?
Yeah, I mean, Susan can definitely speak to some of what I think might happen in the regulatory space, which that could go anywhere. But I think there's these emerging trends. Everybody's talking about AI. I think there's some really great novel uses of AI, but then I also think some people are just doing AI to do AI, right? So I think that there'll be you'll kind of see some things that are going to float to the top that where AI has really solved some really great problems. So I think that's definitely a trend. I know we talk about whole person care all the time, and we've been talking about it for years, but the problem is we haven't moved the needle on it enough. And so I do think that is going to be a bigger part of the conversation in the next few years. The other trend that I'm really seeing is the whole idea that health information exchange and community information exchanges are all combining, or they're becoming one entity, or HIEs are adding community information exchange, or community information exchange is partnering with an HIE. So there's a lot more happening in that space. And there's a communication layer that is still a challenge, because one is community-based organizations that are not clinical trying to get clinical data, and what's allowed and what's not in that ecosystem. So there's still some challenges to be solved, and I think we'll see some movement there.
What I've learned from advocacy and regulatory legislative, that you have to follow where the bipartisan work is going. So right now it's rural health. So the rural health transformation, what can we do with that, and how can we make it be successful and sustainable? Because as we've seen with the public health data modernization, you drop a bunch of money on something and it's not sustainable. And can we really make a difference in the rural health space and elsewhere? And tagging on to that, there's an aspect of that I hope some of that money is used for, but will probably be, unfortunately, down the list, is cybersecurity. And that is, as we move for the actors, much more sophisticated. Everyone's more at risk than they know. People are at risk. The AI infiltration of voice and video, and it's really terrifying. How do we protect our patients, our providers, and all of that? I would like to see Because last year there were 3 different bills in Congress for healthcare cybersecurity, all with a different flavor. And if they all could have been combined, probably would have been a pretty great package. And none of them went all the way through. And my happy place is that once we get through our current funding arguments, whatever, that's neither here nor there, that we can get back to that kind of business. And that maybe we can see I would love to see a privacy legislation, because that's the other concern I have, is the different states making up their own privacy and AI rules in absence of federal work. So just keep advocating for comprehensive reform of privacy and security.
Fascinating. Now, my listeners love to hear about trends in the space, but they also love to learn about women leaders and what drives them, what moves them. So if you could give your younger self, a piece of advice, what would you tell her?
Well, I feel like a lot of us have that whole sort of imposter syndrome thing that goes on, the whole idea that we can do stuff, but we're not sure we're good enough. And there's a place where you sort of arrive one day where you realize, wait, I actually do know what I'm doing, and I'm actually smarter than I thought I was. And so I think my younger self, it really would be around just trusting myself more and not feeling like I had to prove myself so much to other people, but really focusing on my strengths and my passions, because I think that's one thing. Not everybody does this, but you should love what you do. And I think being able to be in a space where you can solve problems and change lives is really meaningful. So that's my take.
So inspiring.
Yes, exactly that. I would have said that exactly. You're stronger and smarter than you could ever have believed of yourself.
Yeah. And I think from you, Susan, just from what I know of you, is that you are always yourself in whatever room you're in. I would love for you to speak to that about you.
It has worked. And I now remember my thought was the thing I would tell my younger self is don't use the what you should do. Get the should out of, there's nothing, I should go this pathway, or I should go because I should approach this way, and really getting to the passion. But I have found I'm a bit quirky, and I'm unique, and maybe I'm not for everyone, but I found out that actually people like that. People attract to that. So be your authentic self. I know I talked to a emerging professional at a recent conference I spoke at who asked some similar questions. And she said, I want to be on stage like you do. I want to speak like you. And I said, and what are your tips? And just be authentic, be real, be fun. We can talk about some really serious stuff, but make it pleasant and enjoyable. And then people will gravitate to that.
Fantastic. Well, I really appreciate you guys sharing your wisdom so generously with us. To finish this conversation off right, where can our listeners find you online?
Yeah, absolutely. We're at convergehlth.com. So definitely look us up there. We're definitely on LinkedIn. We love to engage with folks and tell us what your pain points are and what problems could we help you solve. We love those kinds of dialogues. So we'd be happy to connect.
Too good. Well, thank you guys for joining us today. It was awesome to have you. And thanks to you folks for joining us too. Check out the High Tea with Grace podcast for more interviews with great guests like Susan and Laura today. Cheers.
Like a Girl Media is more than a media network. It's a community. We want to meet you and amplify your voice and the voices of outstanding women innovating in healthcare. Interested in starting your own podcast or hosting an event near you? Connect with us online or in person. We're here to support and empower you.